Good afternoon. Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force briefing with Dr. Alex Garza. The briefing will begin in a moment. After Dr. Garza makes brief remarks, he will address questions that have been submitted by members of the media. Reporters who have questions during the briefing can submit those to the Task Force Public Information contacts. We will address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, good afternoon, everybody. And I know this is a holiday weekend for many of us in the region, and it's a particularly difficult one, if not an unusual one, because we can't gather in person with our families and friends. But I hope that you will take this time to reach out with them either by phone or online to those who you would normally visit on this holiday. They still need to hear from you in person just as much as you want to see them. So I'm going to keep my remarks brief today so that you can get back to your weekend and your families. Tomorrow we will not be conducting a briefing. We'll plan to share a written status update with the media tomorrow afternoon at around this same time. So let me get to our data slide here. So this is the latest data that we've been sharing with you throughout the week. And again, these are data that are compiled from the major healthcare systems, BJC Health, SSM Health, Mercy, and St. Luke's. So as you can see, our hospitalizations are up from yesterday, from 584 yesterday to 592 today. The number of patients in the ICUs is up slightly as well. It was 205 yesterday, and today we're up to 211. And the number of patients on ventilators is about the same. Yesterday we had 160 patients on ventilators, and today we have we have 157. Across the system hospitals, we've had 49 COVID-19 patients discharged yesterday, so that's good news. Since last Sunday, our inpatient COVID and what we call our patient under investigation, so it's presumed COVID, but waiting for test results to come back, those numbers are up around 26% from last Sunday. And because of that, we still believe we're on that steep part of the curve, but we're starting to see that the measures everyone is taking is helping, and it's having an important impact. We still anticipate those numbers increasing over the next couple of weeks, or what we've been calling the surge over the next couple of weeks. But really how big that surge ends up being is dependent upon us in the community. And so you've heard me say repeatedly that we can take care of the patients within the four walls of our hospitals, but how many patients and how well we take care of them is really a community effort. And so I certainly appreciate everybody's attention to social distancing, hand washing, keeping surfaces clean, and wearing masks, and that's much appreciated. And now we'd be happy to address some of the questions that we have received from the media.
Dr. Garza, now that schools in Missouri will remain online only, and with the Easter holiday for many tomorrow, how should parents speak to their children about the virus and the importance of social distancing?
Right, that's a great question. I have 3 children myself that are all home from school, and so the message that I've been telling my children is, this is an important issue. First off, that the virus spreads through contact with other people and through transmission from touching surfaces, things like that, and so it's still an important reason for us to practice social distancing and to wash our hands and to be cognizant of not gathering in groups, things like that. And so it is, although they miss their friends at school, they miss all the social things that they normally do, but the reason why we're doing this is for the greater good of the community. And I can think of really no other time to emphasize that than on a holiday weekend where sacrifice is an accepted thing with holidays. And so that's how I'm teaching it to my children.
You touched on this in your remarks, Dr. Garza, but anything else you can say about an updated number on local recoveries?
Yeah, so I'll just go back to the numbers that we shared. It was 49 COVID-19 patients that were discharged yesterday, which is good. And I'm just trying to think back to the number that we've had discharged over the week, and I believe that's a high point. But I don't want people to misinterpret that. So those numbers are going to ebb and flow, but it's always nice to have some good news when patients recover and are able to get back to their families and friends.
As far as positive cases and potential deaths in the region, do you project that this past week or next week will be worse?
Oh, that's difficult to say. So, from the modeling, we know that we are on that steep part of the curve, and so we're anticipating more cases coming about for the next couple of weeks. And so that's what we've been anticipating. That's what we've been preparing for. All of those things. Now, how many patients we end up seeing in the next couple of weeks is dependent upon that decrease in spread in the community. And so if you think about the way that cases show up in our facilities, there's usually anywhere from a couple of days to a week or so of lag time from when people are exposed and become infected to when they become sick enough to be seen in the healthcare sector. And so it's difficult to absolutely time when we're going to see that surge in cases, but it's all dependent upon spread. And then the other thing I would caveat with that is people can still be infected and be asymptomatic, so we'll never see them. Some patients will have minimal symptoms, and we will never see them. So those are the ones that we see within our hospitals are the people that are sick enough to be admitted, and then we get the positive cases from our outpatient testing.
Based on what you're seeing right now, would you recommend that the stay-at-home order for the region be extended beyond its current date?
Again, a tough question to answer, and the reason for that is we don't know where we're going to be in another week, and I forget when the stay-at-home order was dated, but we know more every week as we gather more data, and then we can start becoming more precise in our modeling and start making more accurate projections. But be that as it may, that's really a discussion that we need to that should be discussed with the public health workers and elected officials, and certainly we're collaborating with them to come up with what we think is the best timing for doing something like this. Again, I will reemphasize, though, that we have to be very careful in relaxing our social distancing rules because you can have that rebound effect where you can get higher waves of infections on the backside if you move too quickly to relax those rules. So it's still a work in progress. We'll gather the data. The timeline is really dictated by the virus and how fast it spreads.
Thank you, Dr. Garza. That concludes the questions that we've received to date from members of the media. Members of the media may continue to submit questions to the Task Force Public Information contacts, and we will address those as quickly as possible after the briefing. As Dr. Garza mentioned, there will be no live streamed briefing tomorrow. Instead, the task force will issue a press release with updated numbers at around the same time tomorrow afternoon, and our live stream briefings will resume at 3 p.m. Monday. Thank you for tuning in.